Universal healthcare is politically controlled medicine. If you value your health, if you value your freedom, if you value your liberty and the health of your family, you will not support universal healthcare. The quote I just read to you is from a pamphlet called Health, the American Way, as distributed by the American Medical Association in partnership with the private sector, including health insurance companies. And that's just one quote in their decades-long propaganda campaign against universal healthcare in the United States. That pamphlet was tied in with other advertising that today would equal $250 million in funding. Exposure to this campaign was correlated to an almost 20% increase in enrollment in health insurance that was private. As health insurers gained momentum in the space, they let out more propaganda. They released a lot of materials that were tied to communism and socialism, which was deeply rooted in fear in the American public. This was intended to associate universal health care with a lack of freedom. Shortly after this, in the 1960s, we had Operation Coffee Cup, which was designed to combat what would later become Medicare. The campaign encouraged doctors' wives to host coffee meetings where they would play recordings. The recordings warned that Medicare would ultimately lead to a loss of freedom and socialism.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project.
If we fast forward to the 90s, the Health Insurance Association of America launched a $20 million campaign. This featured the fictional couple, Harry and Louise. I was first exposed to this campaign during my political communications class during my PhD. Let me read a few quotes from it now. Things are changing, but not for the better. The government may force us to choose from a few plans designed by government bureaucrats. Having choices we don't like is no choice at all. If they choose, we lose. In recent years, the health insurance industry has set its sights on Medicare for All. Their new weapon, the Partnership for America's Healthcare Future. Millions were spent on ads that claim that Medicare for All would increase taxes and eliminate patient choice, further spreading fear to protect their corporate profits. It's not just ads, it's lobbying. They've spent hundreds of millions to keep universal healthcare off the table. In 2022 alone, health insurers spent $128 million lobbying Congress. This lobbying helps ensure that our politicians hear one voice loud and clear, the voice of profit-driven health insurance companies. And in today's digital age, health insurers use targeted ads on social media to make sure they get their message across. These most modern ads still use fear. They assert that universal healthcare would result in a loss of healthcare workforce and patient outcomes. But these claims are based on the studies that they fund for themselves. For example, in 2009, a consulting group owned by the United Health Group claimed that 119 million Americans would be forced out of their private health insurance and into government-run plans. These studies are presented as independent research, but they're designed to create the outcomes that the health insurance companies and the for-profit industry in healthcare wants. For decades, the for-profit healthcare sector and health insurance companies have funded campaigns that have caused fear, misinformation, and they've spent billions of dollars to block universal healthcare. If you learned anything, let me know what you learned.